Holy moly. We are, let's see, I think we're live. Oh man, it's not. There we go. Okay. It looks like it did connect to Facebook. Okay. Looks like we're actually live. Technology is something else, but it looks like we're all connected. It looks like we should be live on Facebook, LinkedIn, and YouTube. So, for those of you that don't know me, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, CEO of Tennessee Health Advocates, founder of The Circle, where we help independent patient advocates build profitable and sustainable practices. So that's what we do there. On Wednesdays, we have live calls. But on Fridays, I really like to um, join and share my friends with you in my Friday Friends live stream. So, for without any further ado, I'm going to bring on my friend Michelle Mosier. There she is. Hey, Michelle. How are you?
Hi. Great. Excited to be here with
Good.
you.
Oh, I'm excited to have you. I just, we were talking before we went on. We were talking about travel and being working remote and how that's important to both of us. And we'll get into that a little bit more. But I do want to acknowledge that I am in a hotel room. So, it is what it is. But are so important. And I think that the message in that is that showing up no matter what really makes a difference. And so it's Friday and I'm supposed to be here. And so we're here. I love
Yes, I
it.
love it.
So Michelle and I are fast friends in regards to advocacy work. She has her own practice. And I'm just going to let Michelle introduce herself and tell us a little bit about how did you become an advocate? What drove you to do that? And we'll start there.
Absolutely. Hello, everyone. I am Michele Mosier. I am the owner, founder, whatever you want to say, of Hope Health Advocacy. And how I got here, I'm actually a pharmacist as well. I've been a pharmacist for over 20 years now. And it was broken. The whole system was broken. I did retail pharmacy for about 10 years. And then I did another almost 10 years in the pharmacy benefits manager area. So that was insurance, the insurance side of things. And I commonly found that really it was all about numbers and not quality. And I was always that person to, well, wait a minute now, we're reviewing a medication for coverage for XYZ person. And let's not push through that just to meet our time frames. Let's remember that that could be our mother or our father that needs that medication. So let's do the right due diligence when we're doing our work. So while this was all happening, I had an uncle that unfortunately we lost in the last couple months. But yes, it was tough.
Sorry.
He's my
Yeah.
godfather as well. But he had two strokes, and I was kind of like, tag, you're it. He had no
Oh,
husband, no wife, no children or anything, and so he lived actually in the house he grew up in. And so I kind of went right in and I said, okay. And at that time, I didn't know it was called advocacy, to be completely transparent. And I was that crazy lady who would go up to the hospital and look at the medical records. And I'm pretty sure they were ducking because I was holding them accountable to what they should be doing. And so I knew what my uncle's goals were. And if they didn't seem to be listening or going the right direction, then I would have to, gently nudge them into a better direction. So again, at the time, I just knew that felt so good to me, that I felt empowered, and like that was more satisfying than, to be quite frank, any pharmacist job I had done. So I said, okay, well, and I bumped into a pharmacist on LinkedIn that had done this work. I learned it was called patient advocacy. Yes. And
I love
so,
that.
yeah, and she offered a course. So I took the course. It led me into a very good direction. And that's kind of how we got here.
I
And
want
so,
to,
yeah,
Michelle, I want to give her a plug. I'm pretty sure that that's Claudia, right?
that's Claudia. Yes.
Claudia Cometa. So, yes.
Yes,
So, if
please do.
you're interested, absolutely, we're connected on LinkedIn. So, if you're interested in learning more about that, feel free to find Claudia. She's on social media. She's amazing, phenomenal.
Yes.
She does great work.
Yes.
I
As a
love
matter of fact,
Claudia.
I
Fantastic.
thought I saw where she was doing it at one point for like a discount or like really
Mhm.
cheap, or if it might have been free, but I don't want to misspeak. But
Yeah.
absolutely, it was very good to get pointed into the right direction. Just even what the heck I was, it was called patient advocacy.
Wonderful.
So I
Yeah.
was reflecting back and I said, when I recited like we have an oath that we recite with our graduating class in pharmacy school. So in 2001, part of that was to embrace and advocate for changes that improve patient care. And I thought,
Wow.
what better way than to do it this way?
Right?
Yeah, and I think it's been about a year and a half now that I just ripped the
Right?
band-aid off and said we're doing this.
I love
And
it.
and so here we are today.
So, what has been so I do have a question that I like to ask at the end, but talk to us a little bit about the clients that you've worked with so far. What kinds of things have they needed you to do, and how have you been able to really enhance and help empower them in their healthcare journey?
Absolutely. So it's funny because I've gotten really a variety of clients, a lot of it comes to communication barriers. I'm just going to be honest. I mean, I don't mean to oversimplify, but there is a lot of that where it's either a communication breakdown between two different providers, or it's a lot of times a communication breakdown between the patient and the provider, or my client, I would call them. But
Right.
so it's bridging those gaps. So that's been probably a lot, but there's been a gentleman that was not being heard, and in bottom line, we just got him to the right doctor that would hear him. And here he ended up having a rare disease diagnosis that
Oh,
these
wow.
other doctors just were not fit to give him the adequate time and care that was needed. And so thank God that we
Right?
found the right provider. We found the right
Mm.
provider who was able to give him the time, listen to him, listen to his needs, and not like say, it's in your head or anything like that.
Yeah.
And
Yeah.
we ended up getting him that diagnosis. So it was like a bittersweet thing. We didn't want to give him a diagnosis per se, but at the same time, it led to the right treatment for him. So,
Exactly. Exactly.
and what
So
was
you
nice
said
is
two
because I'm
things.
sorry,
Okay.
real quick. So
Yeah.
sorry for interrupting. But as a pharmacist, it's nice so I can transition from, you know, getting those gaps put together
Mhm.
with communication, but then also, hey, now I can turn my pharmacist hat on. And with that new medication, he had a lot of questions. And so I was able, and
I
it's a
bet.
pretty, I hate to say this, more toxic kind of medication. So
Oh,
there's a lot of things to really watch for. So I was able to help him through that with the anxieties with starting that new
wonderful.
medication. Yeah.
Oh, yay. Well, he was fortunate to find you and to have you for
Thank
sure.
you. Thank
Yeah.
you.
So you said two things in your answer there that I kind of wanted to talk about a little bit more. One is this whole idea of communication. I feel like, as a healthcare administrator, I worked with lots of doctors and we saw lots of patients in our clinics and what I found was that the physicians didn't always know how to hear the patient,
Absolutely.
right? And I also saw the patients not understanding, like, there's a fundamental communication breakdown between physicians and providers and patients that I see pretty regularly. And talk to me a little bit about what you do with the patient side of that to kind of help facilitate and bridge that gap. Because I've often wondered, what could we do? I've been on the
Absolutely.
administration side, so I've been watching. What could we
Right.
do to kind of help with patients understanding and being able to bridge that communication. So what kinds of things do you find yourself doing?
Absolutely. So I think that the gap happens on both ends. I think that the provider is trying to do their best, his or her best, but because of time restraints, they don't have the time
Right.
to slow down the visit, and they don't have time to talk in layman terms to their patient,
Right.
and so yeah. So and then the other side of it is, I think that they maybe don't know how to, or they, I think some doctors are better at it than others. I'm
Sure.
sure they go through training to do that, but I do think that, so from the client perspective, that side of it, I think there's multiple reasons. Either they are like more anxious about going to a doctor and they don't know the right questions to ask, or
Mm,
they don't understand, they're just they're, like I said, back to the terminology is too much for them. So what I do
yeah.
then is I actually can remote into a doctor's appointment with
Right.
that client. So it's like a three-way call, and I've done this multiple times, and I slow that visit down. And so, it's, I can have a, I can extend an appointment to 40 minutes maybe, so I
Wow.
don't like to say I do that all the time, because we are respectful of the
Sure.
doctor's time, but that's just an example of, we slow it down. So I get what the client wants, and, the patient wants at the beginning of, like, what are your goals? What are your wishes? Okay,
Love it.
great. Now let's bring that to the table. That we're going to make sure your voice is heard here. We're going to slow this down.
Mm,
And then afterwards, the things that they don't understand, I am able to break it down for them into layman terms
right.
of something they can understand. So
Perfect. I
I hope I
love that.
answered your question.
Yes, you did.
Okay.
You absolutely did. The other thing that you just said, and I do want to talk about this really briefly because I don't see or hear people talking about it enough for my liking, and that's the whole idea that doctors and providers are under really, really tight constraints.
They are.
And I think that sometimes in our rush to, as humans, we want to point fingers and have it be somebody's fault and all of the things. And sometimes I do think that providers have a hard row to hoe
They
sometimes.
do.
I think that, so I'm thinking specifically that one of the reasons that I left administration was I had doctors on my roster who were literally seeing 30, 40 patients in a 4-hour period. And
Absolutely.
that is insane. That is so crazy to think that's what's happening. And so it makes that ability to utilize that time, right, in such an efficient way. And I think that's what you're saying is that you help patients utilize that time efficiently and
Right.
extend it if necessary. That's what I'm hearing. Is
Exactly.
that
Right. Because,
okay?
yes, because I mean, honestly, to save time, it's almost like some doctors can get into that cookie cutter approach where, okay, every person that has XYZ disease, we're starting them with this, or they're going to surgery. And so it's kind of just slowing that down. And I don't blame them for being that way. That is how they're probably getting through their caseload. But
Absolutely.
I'm there just to kind of slow it down a bit appropriately, and make sure that the patient's voice is heard, and that, it's more individualized.
Sure. I love it. I love that. I think that's
Thank
so
you.
incredibly valuable. Because of the things that we've just described, so many. I can remember, there was one particular physician, and then we'll kind of that literally enjoyed a particular patient because this particular patient always came with their own, like, objectives for their appointment.
Wow.
And
Wow.
I can remember after clinic, there were comments the physician would say, she had some really good stuff this week. I'm really glad that, she asked about this and we're looking at that. And it actually improved, I think, the whole experience for both parties. right? For the
Absolutely.
patient and for the physician. The physician really seemed, from my perspective, seemed really super engaged in that case.
Absolutely.
And,
Absolutely.
so I
And I'm
love
glad
that.
you mentioned
Love
that
it.
because I have seen that as well. And I tell my clients right away, I'm like, you will be amazed at just having an advocate on this phone call will make it go a little bit smooth. Like they slow it down a bit. It's just the presence of us being there. And when you come prepared, and that's what I tell we have to do
Yes.
our
Yeah.
part too. And when you're prepared, they see you care more about your health, and they get, as you said, more engaged as a result. And that's better
Yes.
health outcomes, you know? So
Right. That improves outcomes, and that's beautiful. And here, it's interesting. I heard you say we have to do our part as the patient too, right? No
yes.
one ever taught us how to be a patient. So
Right.
that's a whole new thing, right? To be thinking about, how do
Absolutely.
I play my part?
Oh
I
no,
love
if you're a
it.
client of mine, we go in there prepared.
I love it. That's great. That's awesome.
Thanks.
Well, Michelle, thank you so much for hanging out with me today. I do have one quick question before we go. Where can people connect with you if they want to learn more about your services or you in general? Where can they find you?
Sure. So LinkedIn is probably the best way right now, but also just my general website, which is Hope Health Advocacy, all one word.com. And I will spell advocacy, although most people probably know, especially your audience, but ADVOCACY. I maybe should have thought about that when
Oh,
naming my
girl.
business.
So you have seen my business name, right?
Yes,
Yeah.
it's
So
pretty big.
literally I was on the phone the other day and somebody said, "Oh, give me your email address and I'll email it to you." I was like, "Can you fax it?" Like it's easier for me to give you my fax number than it is to give you my email. I was not
That is
thinking. I
so
got to figure
funny.
something out. Yeah.
Yes,
And
yes.
the struggle is real.
Yes, absolutely. And then, if you don't mind, I would love to also put a little plug into that. I'm also available to. Is that okay? That I'm available to other advocates as well. So if
Nice.
you want to elevate your practice and kind of have like a premier service of that, you have a pharmacist like on
Love
board.
it.
I am building that out as well. So I've worked with a nurse
Wonderful.
doing that already, and we've had some good results. So yes, and then
Fantastic.
yeah,
That's
and
awesome.
then I just wanted to tell a little bit about my business name really quickly, Hope Health
Yeah.
Advocacy. So of course, hope is just that, wanting to like when people feel like they're at their wits end, that they, have no other options, a lot of times we do get calls. It's usually when it's,
Yeah.
they're frustrated, right? So that's why
Right.
I picked the hope part. But and then the health is just because I do feel that when you engage an advocate that it can be, it will give them better results and hopefully a more optimal health outcome of one way or another. So I just combined the two words really, but into one. But the quote that I really love, and we can end on that if you'd like,
Yes.
is, and it's on my website, but it's by Harriet Beecher Stowe, and it's never give up, for that is just the place and time that the tide will turn. So you just don't give up.
That.
Don't give up.
That's right.
Yeah,
I
and
love it. That's
call
beautiful.
an independent patient advocate. It doesn't have
I
to be
love it.
me, but there are a lot of others out there as well.
Love it. Ah, Michelle, thank you so much. What a
You're
great
welcome.
Friday it's been.
Uh,
I love to hang out
Likewise.
with you. All right. Thanks, guys. We will be back next week with another friend. I'll see you then.
Thank you.